Hello everyone, today we shall discuss regarding bandaging. Now, as you can hear from the word bandaging, it has something related to bandage. And where do we put the bandage? We put the bandage over some injured or cut region, or that is a wounded area. So let us see in detail what is bandaging about. Bandages should be applied firm enough to keep dressing and splints in position. Now, bandages are something that need to be applied or put in the regions so that that area which has been hurt or wounded does not move and is been kept in a firm position, but not tight as to cause injury to the part or to impede the circulation of the blood. Now, when bandages are applied, it has been applied to any wounded or injured area. So, when the bandaging is being done, it is done with the purpose to make the sure that the wounded area is being properly covered. But also it has to be made sure that the bandage is not very much tight so as to interfere or stop the blood circulation in that particular region. A bluish tinge of the finger or nails may be a danger sign that the bandages are too tight. Loss of sensation is another sign. Sometimes what happens is, over an injured or a wounded area, when bandaging is being done, the bandage has been tied too tight over that region, and because of that there is a problem with the circulation. There is loss of blood supply in that region, and because of the loss of blood supply, let us assume that the fingernails are being exposed, so they will be changing into color to a bluish tinge. Or what else can happen is nails, the changing in the colors of the nails, they are having a bluish tinge. So if this is happening, it is called as a danger sign, a warning sign, indicating that the bandage is too tight and it is causing a loss or damage in the circulation, and because of that a bluish discoloration can be seen. Loss of sensation is another sign. Because of being too tight, the bandage being too tight, the sensations in that particular area cannot be felt. So, loss of sensation along with the loss of circulation is another dangerous sign. A single gauze dressing is often not enough to immobilize or to provide support to wound. Now, majority of the times when bandaging is being done, the gauze material is being used. Now, a single gauze cannot be used for the purpose of the bandaging. So, multiple things are to be done while bandaging is happening over a wounded region. Bandages are used to secure dressings, apply pressure, and to support the wound. They are especially useful in the injuries to the extremities. So, what are the different purposes of the bandages? Secure the wounds, apply the pressures, to put the area in a proper position so that no further movements of that injured place is happening, and these are the few of the purposes that the bandages serve. Injuries to of the extremities, in case if it is happening, and majority of the times when injuries of the extremities, that is the upper limbs and the lower limbs is happening, bandaging is served very helpful. Bandages are strips of cloth, gauze, example roller gauze, of elasticized material, example ace bandages, to wrap a body part. Now, we are repeatedly hearing the word bandages. So, what are the bandages made of? So, bandages can be made of a cloth, that is called the gauze bandage, or an elastic material called as an ace bandages, with the purpose to cover the injured part. They come in packed in rolls and vary in width from 1 to 6 inches. Now, when bandages are coming, they are coming in the form of rolls, and these rolls are in packages. So, each package can be, bandage roll can be 1 inch to 6 inch available. Now, When the bandages are being discussed, the thing that needs to be discussed more in the bandages is there are various types of the bandages available, and depending on the type of the extremity involved and the area to be injured and the purpose that that bandage is to serve, the different type of bandages are being selected. Bandages are usually made of cotton cloth, calico, elastic net, special paper or other materials. So what are the major materials that bandages are made up of? Cotton cloth, calico. Calico is basically a plain woven textured material. Then elastic material or simply a special paper or some other material. And are used to maintain direct pressure over dressing to control the bleeding. So what is the main purpose of the bandage? The main purpose of the bandage is to put pressure over the dressing so as to cover that particular area. Hold the dressing or splint in position, restrict movement. Now, other than applying of the pressure, the second purpose that the bandages serve is holding that injured area in proper position. So that is the second purpose of the bandages. Assist in carrying or lifting casualties. The third purpose that the bandaging serves is they help in lifting or carrying of any of the casualties. Emergency bandaging materials may include any cotton cloth, stockings, scarves and belts. Now, in case if any emergency scenarios has occurred, any road traffic accident has occurred or any of the disastrous scenarios has occurred and bandages are to be used. So, in these scenarios, any of the cotton material, any belts, any scarves, anything can be used as a bandage. Now let us see what is bandage. A bandage is any gauze or cloth material. As you can see in the picture, bandage is any of the gauze material or a cloth material used for any of the purpose to support. So as the bandage is made up of any cloth or a gauze material, it serves multiple purposes. Now what are the multiple purposes? The number one purpose is to support. The number one purpose is to support. The next purpose is to hold or to immobilize the body part. So either to support the injured body part or to immobilize, that is to restrict any of the movement of the injured body part. Bandaging is a technique of application of specific roller bandages to different parts of the body. Now, what is happening in bandaging? So, definition of bandaging states that bandaging is a technique. Now, in this technique, what is done is the application of a bandage to various body parts is termed as bandaging, which can be done through any cotton material or a gauze material with the purpose of to apply pressure or to immobilize that particular part. The various furthermore purposes of bandaging are to control bleeding by pressure. When there is an injured part and extensively bleeding is happening for that part, so bandaging is being done in that region so as to apply pressure and to stop the bleeding from that particular region. To immobilize sprained or fractured limb. In case of any sprain has occurred in any of the regions or fracture has occurred, so as to not cause any further movement, unnecessary movement of that injured region, bandaging is to be done. To hold a dressing or compress in place. Again, to hold the dressing material that has been covering the injured part, bandaging is to be done. To secure splints in case of fracture or deformity. Now, in case of the fracture, splinting is very much essential. So, to hold the splints, bandage serves a very much purpose. To protect open wound from contaminants. In case of any injury, the wound has been exposed to the external environment. The inner structures are exposed to the external environment, risking the chances of developing infection and by coming in contact with the external agents. So as to prevent all these things, bandaging is to be done to cover the area completely. To provide support and aid in case of varicose veins or impaired circulation. Now sometimes the tight bandages causes impairment in the circulation, but in majority of the times bandages are being done to improve the varicose vein scenario or to improve the circulation also. So these are the few of the purposes that the bandaging serves. Functions. So now what are the functions of the bandages? Bandages applied over or around dressing can provide extra protection and therapeutic benefits by the following. So in case if there is a dressing done over an injury or a wound, so those bandaging serves a majority of the several purposes. So let us see in detail what are the various purposes that it serves. Creating pressure over the body part. Example, an elastic bandage applied over an arterial puncture site. For example, when there is an extensive bleeding over an artery site. So if there is an arterial puncture site, as it states in the example, if you are putting an elastic bandage over it, so it applies more pressure and hence the bleeding can be controlled and ultimately stopped. Supporting a wound. Example, an abdominal binder applied over a large area. In case of any abdominal wound, if an abdominal binder is been covered over that extensive wound, so it works as a support. Immobilizing a body part. Example, an elastic bandage applied around a sprain. Majority of the times when sprains happen, immobilization of the part is very much essential. So this cannot be done without bandaging, and hence bandages serve a very efficient role in when it comes to sprains and immobilization of those parts. Reducing or preventing edema. When there is a fracture or sprain or any injury, edema is happening very much quickly. So as to reduce the chances of developing edema or worsening any other complications, bandaging is to be done. Now, as majority of the things has certain principles that has to be followed, similarly, while doing the bandaging, there are several general principles that have to be taken into consideration and to be followed. The patient should be placed in a comfortable position, and it should also be the position of the part to be bandaged should be well supported and elevated by the nurse. Now, whenever a person is being done has to be bandaged, like for example, a person is coming and requiring that over an injury part or a sprain part, bandaging has to be done. So the responsibility of the nurse, the first and the foremost responsibility is to put the patient in a certain comfortable position. Now this position has to be as such that it is convenient for the nurse to also tie the bandage, and elevation of that region is also happening. So these are the first principles, that is the comfortable position for the patient. The second being, the nurse should stand directly front of the patient or facing these part to be handed. Now the nurse, when it is giving the comfortable position to the patient, so now the nurse should stand directly in front of the patient or in front of the region that is to be handled. This has to be the position of the nurse. A bandage should accomplish its purpose. It may be used to hold the dressing and support a part or to immobilize. Now, whenever bandaging is to be done, it can be done to the majority of any of the purposes that we priorly discussed. Whatever that purpose is, the bandage which should be following or for making it useful of any of the purpose. It can be immobilizing, putting pressure, anything, but the bandage should serve the purpose. This is one of the another principle. Apply and fix bandage at least 2 circular turns around the part if it is smallest in, so that it can stay in place. Now, when the bandaging is to be done, what has to be done? The gauze bandage or the elastic bandage has to be done is completely cover the area in 2 circular turns. Circular turns indicating a complete circle has to be covered by the bandage over that particular region, so as to be confirmed that the area is been properly covered. Skin surfaces should be separated by either gauze or cotton. Now, when the dressing is to be done, it is to be properly covered with a cotton or a gauze to separate it from the bandage, and it has to be moving at least 2 circular turns. Always bandage to the right and exert even pressure as far as possible. Whenever bandaging is to be done, it is to be done from the right side. And what is that? Adequate pressure must be maintained while the bandaging is to be done. Bandage should be done in the direction of the venous circulation. Now the body will be having the venous circulation. So based on that venous circulation direction, bandaging has to be done. Do not cover the ends of fingers or toes unless it is necessary. In order to cover them, it is necessary to observe the circulatory changes. In case the feet or the hand are to be bandaged. So in this scenarios, what is to be done is the fingertips and the toe tips have to be exposed. Why it is to be exposed? So that if there is a bluish discoloration of the fingers or if there is a change in the color of the nail beds, it can be observed quickly, as these are the danger or the warning signs that there is a problem with the circulation and the bandage is being tied too tight. So these changes can be observed, and hence because of that it is a principle that not to cover them while covering the area to be bandaged. Never apply a wet bandage when wet bandage applied, because it tends to shrink a bit and be tight as it dries. So what is happening is, when wet bandages are being applied, do not apply it very tightly, because when it will be shrinking, it will get dry enough, so it will be causing it will be shrinking and it will become very much uncomfortable for the patient, as it will be very much tight. Do not apply a bandage too loosely, because it may slip and expose the wound. So again, now as it is being said that do not apply the bandage too tightly. So the opposite of that also needs to be considered. Do not apply the bandage too loose. Imagine a person who is having an injury or a wound, who has been the dressing of the cotton or the gauze has been done on it, and the bandage covered over that region is very much loose. So what will happen? The cotton and the gauze will fall from its place and leave the wound open again, and hence the loose bandage serves no purpose. So loose bandaging has to be avoided. All turns of bandage should be made clockwise unless there is some special reason for otherwise. So when the bandaging is to be done, it has to be done clockwise, unless and until there is some other purpose that it should not be done clockwise. The roll should be held in the palm of the hand, with the free hand of the be coming from part of the roll. So what is happening? When you are holding the bandage in the hand, the free roll should be covering the side of the injured area in the clockwise direction. After applying bandage, secure terminal extremity by pinning with safety pins or adhesive. Now when you are going to be holding the roll in the hand, what is that? After you complete the turns over the injured area to splinting purpose, pressure purpose, or any of the purposes, it has to be pinned safety with the safety pins. Examine the bandage part frequently for pain and swelling. Now along with the safety pins, adhesives can also be used to hold the bandage in the particular region. Now when after the bandaging is to be done, continuous monitoring of that region. Continuous monitoring of the region is essential to make sure that there is no pain and complaints, there is no circulatory problems happening, no edemas occurring because of the tight bandages or because of the loose bandages. There is no exposure of the wound region. So because of that, continuous observation has to be done. Now let us see the different types of the bandages. What we discussed till now is the definition of the bandaging, that is the technique of applying of the bandage is called as bandaging. We saw the different principles and the purpose it serves. Now let us see the different types of the bandages. The number 1, circular bandage. Now the word itself suggests when the bandage is to be done circularly, it is called as the circular bandage. What does circularly mean? It has to go in the circles, continuous turns. The bandage is wrapped around the part with complete overlap the previous bandage turn. Imagine a bandaging is being done over this particular region. If it is completely covering this region again, it is said to be a circular turn. So, and if it is overlapping the previously bandaged area, it is said to be a circular bandage. Overlapping of the previously bandaged area makes it a circular bandaging. This is used primarily for anchoring a bandage where it is B and where it is terminated. This is primarily done so as the bandage stays in that particular position and does not need to cover any of the other regions. Spiral bandage. The bandage ascends in a spiral manner so that each turn overlaps preceding one by 1/2 or 2/3 the width of the bandage. See, circular means it is completely overlapping the previous bandage. Spiral means it is going in the form of a spiral. That is, the previous bandage will be there. It will be only overlapping 1/3 portion or the 2/3 portion of the previous region. So this is called as the spiral bandaging. The spiral turn is for the wrist, the finger and the trunk wrist. So in case of the wrist, the trunk and the fingers, spiral bandaging is being selected. Figure of 8. Now this type of bandaging is different than the circular and the spiral. So what is the figure of 8? The figure of 8 turn consists of making oblique overlapping turns ascend and descend alternatively. Now it is a method of overlapping. It will be overlapping, but it will be overlapping obliquely, looking like it is made in a shape of the letter or in the number 8. So if it is going in the way of the number 8, so you are saying it is a figure of 8 type of the bandage covering. It is effective for use around joints such as knee, elbow, the ankle and the wrist. Now if it is covering the areas of the joints, it can be a knee joint, it can be an elbow joint, it can be any of the joints, ankle joints. So in this region the figure of 8 is being selected. So different types of the bandages include the circular bandages, the spiral bandages and the figure of 8 bandages. Now let us see the different ways it is being bandaging is being done. The number 1 is the spiral turn. Spiral turns are used to bandage parts of the body that have uniform width. Example, upper arm and upper leg. Uniform width, when there is the width of that particular body part is going to be same continuously. So in this region the spiral bandage is to be done. So as you can see the picture, the overlapping is done only in the 1/3 or the 2/3 regions. So in this regions, if the overlapping of the previous is being done, it is called as a spiral turn. The method of doing the spiral turn. Anchor bandage at distal end of body part with 2 circular turns. The whatever part of the body that is to be bandaged, go to the distal region of that body part and cover with the 2 circular turns. Make a series of spiral turns at about 30-degree angle, each turn overlapping the previous one by 2/3 width of the bandage. So now after the 2 circular turns, what you need to do is overlap that. Now the overlapping has to be done only onto the 1/3 or the 2/3 regions. Terminate the bandage with 2 circular turns and secure the end of the bandage. Now after the region to be covered is completely covered, you need to terminate the bandage with the help of some adhesives or with any of the safety pins. So this is how spiral turn bandaging is being done. As you can see in the picture, begin bandaging from the medial aspect of the basal joint of the toes towards the lateral aspect of the foot. As you can see how the bandaging has been starting to circular. Second, secure the bandage. The bandage is now being held in a proper position. Third, continue bandaging with the turn across the metatarsals. So now as you can see around the metatarsals, the turn has started to take the bandage over the lower heel and return it over the metatarsals. Now from the metatarsals, they are moving on down toward the heel and covering the entire region. Take the next turn over the upper heel and Achilles tendon, continuing the medially. Now the Achilles tendon and the upper heel is been covered. Covering of the ankle by wrapping the bandage spirally. As you can see in the picture, it is overlapping 1/3 region only and the spirally bandaging is being done. Continue spiraling the bandage up the leg, overlapping each turn by half of the bandage width. So continuing it towards the upper leg, finishing the bandage approximately 2 fingers width below the tubal tuberosity. Now when it is coming to the tubal tuberosity, it is stopping over there and the bandaging is being not continued anymore. If a second bandage is applied, it can start at the basal joints or the ankle, but it should be spiralated, applied in its opposite direction. So now the direction that is maintained, if any second bandage is being used, it has to be applied in the opposite direction, and this is how the entire spiral turn bandaging is being done. Now after the spiral turn, the second one is the spiral reverse turn. As you can see in the picture, it is spiral, but it is in a reverse direction. So let us see. Spiral reverse turns are used to bandage inverted cone-shaped body parts such as forearm and calf. Now if there is a body part such as forearm or calf, in this body part, spiral reverse turn type of bandaging is being used. It is used for parts which vary in thickness and upon which bandage of circular turns cannot be tied properly, like leg and forearms. Now what is that? In case of the leg, forearms and the calf region, the width of the region is not continuous, and because of this region, the spiral reverse turn is being selected. One or two simple spiral turns are usually made to forearms to carry the bandages to the point at which the spiral can no longer be employed, and then the lower edge of the last spiral is fixed with the thumb about halfway between the midline and the outer surface of the limb. So what is being done is this one or two times the spiral turns is being done. It is being done completely up till the time that no more spiral turns can be done. After that, the lower edge of the last spiral is fixed with the thumb about halfway between the midline and the outer surface of the limb. So after, now no more is to be done. So now the distal part, the lower edge of the last spiral is fixed with the thumb and to be continued upon in the further formats. That is to be halfway between the midline and the outer surface of the limb. The bandage is then reversed and brought down and carried around the limb when the another reverse is made immediately above the former one. Now after you are stopping over there, the bandage has been taken turn, brought lower down to the limb, and this again the circle is being made. These reverses are repeated as far as necessary, and the bandage is completed with one or two spiral turns straight around the limb. Now these reverse processes are continuously being done until the entire area is being covered. Care should be taken that each reverse occurs immediately above the previous one so that the pattern is even. Each turn should cover 2/3 of the preceding one as in the simple spiral. So as it is done in the simple spiral, that the previous overlap should be covering 1/3 or the 2/3 region. Same it is to be followed over here in the spiral reverse turn, and not only that, it has to be made sure that the entire region is completely covered. Anchor bandage at the distal end with 2 circular turns. Now in how to do the spiral reverse method. Now you select any of the area which is to be done with the spiral reverse turn. Now you do the 2 circular bandaging turn over that region. Bring the bandage upward about at an angle about of 30 degrees Celsius. Now after doing the 2 circular turns, you bring the bandage upward at a 30-degree angle. Place the thumb of the free hand on the upper edge of the bandage. Using the other hand thumb, which is a free hand thumb, you are going to put it on which region? The upper edge of the bandage. The upper region of the bandage, the thumb is to be placed. Unroll the bandage about 6 inches, then turn the hand so that the bandage falls over itself. Now you need to pull it, you need to unroll the bandage to 6 inches, and then you need to make a turn so that the bandage automatically falls over the region. Continue advancing bandage until desired proximal point is reached. Make each bandage turn at the same position so that the turns of the bandage will be aligned. Now, till the entire region is to be covered, this process has to be continuously followed until the entire region has been totally covered. Terminate the bandage with 2 circular turns and secure the bandage. When the entire region has been covered, terminate the bandage and be fixed with the adhesive tape or the safety pins. Now the figure of 8 turns. Figure of 8 turns is often used for immobilization. The purpose of the figure of 8 turns is the purpose of the immobilization of the injured region so that the injured region does not move. It is effective for use around joints such as knee, elbows, ankle and wrist. When the joints are being involved such as knee joint, elbow joint, wrist joint, so in these regions the figure of 8 is being used. It is used for bandaging limb and covering for joints. So for the purpose of bandaging the limb and covering the joints, figure of 8 is being used. As you can see in the picture, in the elbow the figure of 8 is being done and you can see the movement is being done in the shape of the figure of the 8. It consists of series of loops encircling the part in form of a figure of 8. Again, as you can see in the picture, the bandaging has been started. It goes again in the upward direction and then descends back in the shape of the figure of 8. The upper loops been completely hidden by successive turns and the lower loops forming the pattern. Now after the upper loops are being completely covered, the lower loops are also been overlapping the upper loops. Each one covers 2/3 of the preceding loop and crossing in the same line. So the next loop is covering the previous loop by 2/3 so as to form a figure of 8 number. The next we have to see is the SPICA bandage. The previously we discussed is the spiral, the reverse spiral turn, and now we are discussing regarding the SPICA bandage. SPICA bandage is a variation of figure of 8 bandage. Now in the figure of 8 bandage, you saw that the figure of 8 is being made on the injured region, that is to be immobilized. Now if there is a minor changes in the figure of 8 bandage, it is termed as the SPICA bandage. It is commonly used to bandage hip, groin, shoulder, breast or thumb. If the bandaging is to be done in the hip region, in the groin region, the breast region, then it is called as a SPICA bandage being used. It is a form of the figure of 8 in which one turn is very much larger than the other. The difference between the figure of 8 and the SPICA bandage is one turn is very much larger than the rest of the turns. It is used for joints at the right angles to the body. Example, shoulder, groin and the thumb. The joints that are located at the right angle of the body, such as shoulder joint, the thumb, in these regions and the regions of the body, that is the groin region. So in these cases, the SPICA bandage is being used. The number 1 is the finger bandage. With the hand pronated, fix the bandage by 2 circular turns around the wrist, leaving the end free from tying off. Now if the finger has any injury and it is to be bandaged, you need to put the hand in a perfectly position so as to immobilize it. The 2 circular turns are to be made on the wrist region. Afterwards, carry the bandage obliquely over the back of the hand to the base of the finger to be bandaged. Now after covering the 2 circular turns to the wrist, that bandage is to be brought at the back of the hand up till the base of the finger. Taking the fingers in order, start from the little finger side. Now one by one the fingers need to be covered starting from the little finger. Take on a spiral turn on the base of the fingernail and then cover the finger by the simple spiral turns. Starting from the base of the fingernail so as to expose the fingernails, the spiral turns are to be made on each of the fingers. Then carry the bandage across the back of the hand to the wrist. Secure the bandage by a safety pin or by tying 2 ends of the bandage together. Now the remaining part of the bandage is brought again at the back of the hand and it has been tied with a safety pin, or the 2 ends of the bandages that are left open are tied together. If more than 1 finger is to be bandaged, then take a turn round the wrist between each 2 fingers and continue as above until the bandage is complete. Now if 1 finger is to be done, you need to only cover that region. If multiple fingers are to be done, each time that finger has been covered, it is to be brought back around the wrist region and then the entire process is to be repeated. A recurrent bandage is used. Commence as before but take the bandage straight up to the back of the finger and over the middle of the tip and down the front to the level of the second joint. So if the recurrent bandage is being used, the procedure is same, except that the bandage is taken straight up back to the finger. So from the straight back to the finger to the middle of the tip, it is being covered, and down to the front level of the second joint. So it is called as a recurrent way of doing the bandaging, finger bandaging. Holding the turns back and front with the fingers of the other hand, make 2 more turns over the tip of the finger, one on either side of the first turn. So holding the turns back and forth, it is to be covered, making 2 more turns over the tip of the finger, one on either side of the first turn. Fix the loop with a straight circular turn as near the tip as possible, and then cover the finger by simple spiral turns as in before. Now the straight circular turn, so you need to fix that particular place, and then the spiral turns is to be done by the finger. Being careful to make them form within outwards, take a straight turn around the wrist and either finish off or before continue the next finger. So we can do is continue with the next finger, or you can bring it down back at the wrist and then continue with the next finger. So this is how the finger bandaging is to be done. Now the spica of the thumb bandage. With the hand held so that the back of the thumb is uppermost, take 2 turns around the wrist, carry the bandage over the back of the thumb. Again, fix the palm in a particular position. Now you make the 2 circular turns over the wrist region and then to bring it up to the back of the thumb. Encircle the thumb with 1 or 2 straight turns so that the lower border of the bandage is in level with the root of the nail. Now after from the wrist, bring it to the back of the thumb and make 1 turn or 2 turn around the thumb so as the root of the nail is being in the level with the bandage. Carry the bandage back of the hand round the wrist and repeat the figure of 8 turns around the thumb and the wrist until the wall of the thumb is completely covered. Now the remaining bandage is carried on back to the wrist and the figure of 8 pattern is being repeated so as to completely cover the region. Complete the bandages with 1 straight turn round the wrist. Now after the entire thing is being done, one last turn around the wrist is being made to completely secure the bandage. As you can see in the picture, the circular turn is being made around the wrist. It has been brought towards the thumb, the single or the double turns, and then it is with the figure of 8, it has been brought back towards the wrist region. Now the spica of the shoulder bandage. Place a small pad of cotton wool in each axilla. Now if the shoulder area is to be done, so you need to put a cotton pad over the each wool of the cotton or wool pad near each axilla. So in the axillary region, a cotton pad or a wool needs to be placed. Take 3 to 4 inch bandage and fix it with 2 spiral turns round the upper part of the arm. So as you can see in the picture, in the upper part of the arm, you can see 3 to 4 inch of the bandage is being done in 2 spiral turns. The upper part of the arm is being covered. Take 2 or 3 reverse spiral turns around the upper arms until the bandage reaches to the point of the shoulder. So now again it has to be done in a reverse spiraling till it is reaching the point of the shoulder. Then carry the bandage over the shoulder across the back and under the opposite armpit. Now after it is being covered, it is to be carried up on the other side of the region under the armpit on the opposite region. Across the back, it has to carry on across the back and opposite side of the armpit. Bring it back across the chest towards the arm around the under armpit and cover the shoulder again, covering the 2/3 of the previous turn. Now from that armpit region, the bandage is to be brought back again to the shoulder, covering the 2/3 of the previous turn. This forms a figure of 8 around the arm and the body, and the turns are repeated until the whole shoulder is covered. Now as you will follow this part, it will be in a figure of 8, and this is to be followed until the entire shoulder has been covered. The bandage should be secured by a pin immediately over the uninjured shoulder. Now after the shoulder region has been completely covered, the end part is to be secured with a safety pin over the uninjured region of the shoulder. Ankle bandage. If the patient is in bed, the heel should be elevated on a support about 6 inches high. If the ankle bandage is to be done, the heel should be elevated up till the 6 inches. If the patient is up, then should be seated in a chair with the foot supported on a stool or another chair. See, if the patient is in a bed, you can elevate the heel up till 6 inches. If the patient is sitting in a chair, you can provide a table or a stool or another chair to put the ankles or the heel. To avoid stooping, the nurse may, if she prefers, sit opposite to the patient and take the patient's foot on her knee. So, for the proper positioning of the nurse can find a comfortable position right opposite the patient and take the knee out of the entire leg in her, on the entire ankle on her knee and place it. Take 1 or 2 turns around the ankle to fix the bandage and then take it on obliquely across the foot to the root of the little toe. So again, around the ankle, that is 1 or 2 turns of the bandaging has to be done. So 1 or 2 turns have to be done to fix the ankle bandages and then take it on obliquely up till the little toe region. Make 1 horizontal turn right around the foot at this level. So then after that, you need to take a horizontal turn right around the foot so as to carry the bandage back over the foot. So as to carry the bandage right back over the foot. For and take a turn round the ankle just above the heel. Figure of 8 turns are then repeated around the foot and the ankle. After repeating this turns, the figure of 8 is being done between the foot and the ankle, and each turn overlapping the preceding turn by 2/3 of its width until the whole foot is covered. So now until the entire foot region has been covered, so this procedure has been completely repeated. Spica of hip bandage. Place the outside of the bandage on the inner side of the thigh about 6 inches below the groin. In case of the hip bandage is to be done, the bandaging is to be done 6 inches below the groin region and in the inner side of the thigh. Carry the bandage horizontally round the limb and make 3 or 4 ascending reverse spiral turns round the thigh. Now cover the entire inner region of the thigh in 3 or 4 reverse spiral turns. Carry the bandages from within outwards over the front of the groin and up around the hip and the back. Now when you are doing that, you need to carry the bandage in the upward region up till the front of the groin and up and round the hip and the back. So from the upward towards the groin, you need to cover the hip and the back region with the bandage. Passing over the prominence of hip bone on the opposite sides. Now when you are covering on the same side of the hip, you need to pass it on to the opposite side of the prominence of the hip bone. Bring the bandage down over the abdomen to the outer side of the thigh and repeat the figure of 8 round the body and thigh until hip is covered. Now this process is to be repeated in the manner of a figure of 8 until the entire hip is being covered. As you can see in the picture, from the inner thigh region, it has been brought upwards towards the covering the upper hip region, bringing to the upper side of the hip prominence and bringing it back towards the lower thigh and securing it in its position. So this is how hip and the groin spica is being done. Eye bandage. Eye bandage. Lay the outer surface of the bandage against the forehead and take 2 circular turns round the head, bandaging away from the injured eye. So now the bandage is put on the outer surface of the forehead and the circular round the head, and it is made in a circular turns around the head away from the injured eye. So over the forehead region, circular turns are to be made away from the injured eye. Carry the bandage on round the head until it reaches the ear on the round side for the second time. So this is to be repeated until it reaches the ear on the round side a second time. Take it obliquely to the back of the head under the prominence at the back of the skull, and from there bring it upwards beneath the ear of the affected side, over the pad of the eye to the circular turn, and continue over the head to the starting point. So now after covering the ear, it is to be brought on the back of the region of the prominence of the head, and from there it is to be covered. It is to bring upwards from beneath of the ear of the affected side. So on the affected side of the eye, you need to bring it from the back of the prominence and cover it from the affected side of below the ears affected side, and then you bring it over the pad of the eye that has been put and make it in a circular turn over the entire head from the starting point. As you can see in the picture, first the circular turns are being made, and then from the back of the bony prominence it is brought from beneath the ear and covering over the entire region. If both the side is to be done, the both same pattern is to be repeated. Repeat this 2 or 3 times until the dressing is covered, finishing with a safety pin just above the good eye. So this entire process is to be repeated 2 times or the 3 times until the entire eye has been covered. The pattern resembles that of the ear bandage, but there are fewer turns. See, this is similar to the ear bandage, but there are lesser turns. The bandage should be light in weight and should not obstruct the view of the good eye. If only one injured eye is there, then it should be in such a way that it is not blocking the view of the uninjured eye. Breast bandage. To support one breast, take 3 inches bandage and starting below the breast to be covered and working away from it towards the sound side, carry the bandage twice around the waist. So first, for the breast bandaging, take a 3 inches bandage and start below the breast to be covered. It is to be started from below the breast to be with the breast region that is to be covered. You start below that region and you need to work around the waist over that region twice. Bring the bandage up under the breast to be supported over the opposite shoulder obliquely down across the back or under the arm. Now the bandage has been brought up from the waist over the region of the shoulder opposite, supported over the shoulder obliquely and down the back across the back region or the underarm, and once more around the waist. Again after that, once more it is moved around the waist and covering 2/3 of the previous turns. This has to be repeated in a manner that it covers the 2/3 turns of the previously wrapped bandage. These turns are repeated until breast is sufficiently covered. So these turns are repeated until the breast is properly covered. To support both breasts, start with 2 circular turns around the waist as for the single breast, starting under the right breast and bringing the bandage up over the left shoulder, obliquely down across the back, under the right arm, across the front of the waist horizontally. If both the breasts are to be covered, you need to be starting with the 2 circular turns around the waist. So first, the 2 circular turns around the waist is to be made. The second needs to be done is the single breast first needs to be focused upon. Let us take is the right breast, and then the bandage is to be brought over the left shoulder. So from the right breast is to be covered and the bandage is brought over the left side of the shoulder and obliquely down across the back, and then from the back side it is brought over the right arm, and then from the front of the waist horizontally the procedure is repeated for the left side of the breast. Carry the bandage under the left arm up across the back to the right shoulder and down across the chest under the left breast. So from the opposite region it is brought over the lower region of the left breast. From here it is passed under the left arm and turns horizontally across the back to beneath the right breast again. So again from that it is covering in a region that is coming back to the right breast again. These turns are repeated until both breasts are covered. So these turns have to be repeated until both the regions of the breast are completely covered. So this is what we have discussed today regarding the bandaging, the types of the bandages, the purpose of the bandages, and the different procedures of how to bandaging to be done. Thank you.